Okay, I think we're going to start now. So this is the COVID webinar, Pupil Physical Health Special, Thursday the 17th of June. I'm Chris Bunting and I'm acting as chair and I suppose MC for the event this afternoon instead of Mark Mon-Williams. And welcome everybody to this afternoon. We've got a really interesting agenda in front of us and some really great positive and useful inputs to share with you this afternoon. I'm going to, I suppose, if we just put this in context, really, and I think it's a story that, and I suppose a description that everybody knows. We've had for some time, really, in Bradford, a really troubling picture being painted for us around children's mental health and well-being and physical health and well-being. And those metrics, I suppose what we've been seeing in Bradford have been concerning now for most of this century and concerning as a trend. And what's happened with COVID, the evidence that we've got from Helen Jepps, from the public health input that we've had, and from the academic and research informed colleagues that we've had on these meetings over this whole year, is that COVID has made the situation get worse. But the end is in sight in many ways, we hope, with vaccines and with the rollout of those. We are hopefully looking into a different situation from September. But the physical health situation in Bradford for young people has been worrying for some time, and it's getting worse. And we look at those figures around obesity, around coronary and respiratory health, levels of fitness, levels of activity, and they've all taken a knock during COVID. So really, a very short kind of introduction to some of the territory that we're going to be covering this afternoon. I'm going to hand over now to Andy Daly-Smith and Ian Holmes to talk to us about the really exciting developments that we're going to be seeing in Bradford over the next year, aligned to the JUMP project, the RIC project in Bradford as well, and a whole city effort around improving physical activity, levels of physical activity for children and young people, particularly the Creating Active Schools framework. And I'll hand over to Andy and Ian now.
Great, thanks Christian, and good afternoon everybody. So just a brief introduction from myself, and I'll introduce Ian as well. So I'm a reader in physical activity and a healthy childhood at the University of Bradford. And I'm also the Deputy Director of CAER, so hopefully I'll become a more familiar face over the coming months. There's really exciting work going on in Bradford at the moment, both within the JUMP project, but more widely in terms of something called Creating Active Schools, which I'll talk to you about in a second. And when I say Bradford is leading the way nationally, I truly mean Bradford is leading the way nationally with this work. It's the first UK-based whole school physical activity framework that is being actioned to support schools to create a whole school approach to physical activity. In September, we were really fortunate that Ian Holmes, who I know many of you will have met already and some may have not, Ian was a primary head teacher at Thorner Primary School just in the outskirts of Leeds. And was well known nationally for his work on whole school approaches to physical activity, both within his own school and through sort of organisations like Move and Learn and the Youth Sport Trust. Ian left his headship and came to join the team at JUMP to lead the Creating Active Schools work. So I think for me, what's really important for this work is it's been led in partnership by someone with an exceptional knowledge of how the school system works, in partnership with academia who can bring the evidence base to that. And I hope what you'll see is how we're then using the implementation model for CAS suits the needs of schools who are obviously doing the work on the ground. So we've got a short presentation that we'll whistle through when I can share my screen properly, which will give a bit of onboarding about what Creating Active Schools is, how it's going to be, what it actually means, and then how we're going to be using it across Bradford in the coming year. So, first of all, before that, why is physical activity important? Well, you know, pre-COVID, the levels of physical activity in children and young people across the nation were low. Especially within Bradford, levels were even lower. And within our South Asian children especially, the levels were lower for boys and girls compared to their white British counterparts. What we saw in COVID, and this was through some of the data that we collected through Born in Bradford, where we went out to the families to understand how COVID had impacted physical activity, is that, as we'd expect, physical activity levels dropped. But actually what that was influenced by was whether children went beyond the home environment during the periods of lockdown. Those who did showed a better response in terms of physical activity. Those who didn't showed a much worse picture. So what that meant is those children that lived in areas that had environments that supported physical activity, so clean and safe streets, access to green spaces, actually managed to maintain a higher level of physical activity than those children who didn't. Well, with the fact that I think it's 14 of the wards within Bradford are within the most deprived within the UK, that was a really sad picture for Bradford, in the sense of children missing out on school were missing lots of opportunities to be physically active. So what this meant for their health and well-being, especially mental health, is again, we saw that decrease over the pandemic period, especially during periods of lockdown. So why is that important? And quite often when we talk about physical activity, we talk about it in the sense of physical health and well-being, but actually the benefits of being physically active are much more widespread than that. So this is something called the human capital accumulation model, and it looks at all of or clearly articulates what all the benefits are of children and adults leading a physically active lifestyle. And you can see physical capital is only one of the elements or one of the benefits that we focus on. But actually there's a financial benefit, intellectual benefit, social benefit, individual and emotional. In terms of the work that schools do, recently the International Society for Sport, Physical Activity and Health have recommended schools as one of the best investments to promote physical activity, primarily because schools are a captive audience in terms of most children from all socio-economic and cultural backgrounds attend school. So therefore it allows us to reach more children. Also, it's a place where we've got a sustainable set of assets. So, well, let's hope the PE School Sport Premium funding gets renewed. I was in a all-party parliamentary group on Tuesday. There is a lot of, there's a lot of strong leveraging going into government around renewing that funding. Unfortunately, there seems to be a reluctance to announce anything sort of prior to schools finishing in July, which is crazy, but we are fighting on behalf of schools to make that happen. But where schools invest in physical activity, we see happier, healthier communities who do better academically. So there's really strong evidence about, especially as we're coming back into this levelling up agenda or catch-up agenda, whichever terminology that we use, that actually embedding physical activity at the heart of the school culture can help to achieve those academic outcomes that we will be striving to achieve and catch up with for those children who fell behind. So a simplistic example of this is, there's this talk about extending the school day. Well, if we extend the school day and use traditional forms of teaching, actually our ability to help children catch up will be minimalised. Whereas actually if we incorporated something like physically active learning for the maths curriculum, especially with those pupils who are in greatest need and maybe don't thrive in traditional classroom settings, actually that is where you will get your best return on investment. So how are we supporting schools? Well, over the last 2 years, we've developed and are now implementing something called the Creating Active Schools framework. So on the right-hand side of your screen, this framework was developed by 50 stakeholders, and those stakeholders were teachers, head teachers, public health, active schools coordinators, UK researchers, international researchers, basically everybody who we felt could present an understanding of what a whole school approach to physical activity looked like. So the framework came out of a design day that we held with the 50 stakeholders and some more refinement through sort of online questionnaires with those stakeholders. So it's been designed by people like you is the key message. It was designed by head teachers who understand the school system, the teachers who work within that system. Just a quick overrun. The way the framework works is you start in the centre by addressing whole school practice and ethos. That drives the policy and vision of the school. And then within that, we have the social and physical environment and the 5 stakeholder groups who are responsible for enacting that whole school approach. All of that then comes together to drive the 7 opportunities that sit at the bottom. Those opportunities are structured in a particular way. The closer they are to the centre line of the model, the greater the evidence is that they will have an impact on physical activity. So this might not be overly intuitive at first, because you would argue, well, surely physical education should be in the middle. Well, physical education already has a relatively high level of physical activity. So anything you do has to enhance that and take it further. Whereas classroom lessons are the most sedentary time generally, and this is a generalization, within a school's day, with maths and English being seen as the most sedentary periods. That's been shown in numerous pieces of research and some of the research that we've produced. So actually putting physical activity into curricular lesson time and integrating it with academic content actually is the best buy for schools. So if you're thinking about how do I invest my PE school sport premium, if you've got any left over, 100% I'll be looking at curricular lesson time for physical activity. So the diagram or framework is a lovely picture that tells us what to do, but it doesn't tell us how to do it. So since September, Ian and myself and wider partners, both within the Bradford, Yorkshire and national partners, have been pulling together what we call an implementation model. Now, it's important to understand this is not implementation on schools. We are not coming into schools. We are not telling schools what to do. We are providing a process that helps schools to understand what their current strengths and limitations are in providing physical activity. And then there's a supportive process behind that to help change that organizational culture and the behavior that takes place in schools. So just to quickly run through this, we've got what we call our, we work with schools about understanding and influencing school priorities. Where physical activity is selected, we move into number 2. So 2 is a profiling questionnaire. So this will all be online as of September, where schools can complete a profiling questionnaire around policy, environment, stakeholders, and opportunities. So the framework has been distilled down into 4 key areas. And each of those areas has got sub-themes underneath it, which I'll show you an example in a second. That then drives some reporting and recommendations. So off the back of filling in that tool, it suggests what you might like to focus on based on what the areas of highest need are. And then it helps with some implementation planning. The good news is you complete this implementation plan within the CAS infrastructure on the website, and that allows you or enables you to download a plan that you can place on your school website that will meet the needs for the PE school sport premium spend. So we've integrated the 2 together. What that will then drive is 3 things to move forward. First is a package of web-based CPD. This isn't going to be ready for September 2021. We'll be developing this over the next year, but this will help drive the agendas of schools by tailoring the CPD needs to what's been identified through the profiling tool as the highest need. So you won't be swamped with lots of CPD modules. You'll just get CPD that is aligned specifically to the high priority needs of your school. Next is what we call the individual school solutions. So that might be where your school has identified the need to invest in an outdoor classroom as an example. So you would go ahead, you would build that classroom, and that would not need the support of the wider environment or community of practice. But what we are trying to do with Creating Active Schools is to bring schools together as a collective to form a community of practice and to identify what we call shared needs or collective school solutions. So where out of 20 schools, 13 might identify a need to enhance the quality of physical education, we would seek to bring those schools together and work on behalf of those schools to tender organisations to come in and deliver that CPD. And in partnership with the academics at CAER, Ian and the team for CAS, is to make sure that you're getting evidence-led, high-quality CPD that is helping to change the practice and behaviour of the stakeholders, for example, or the teachers within your school. Behind this, we're building a monitoring and evaluation tool so you can see the impact of the work that you're having on an annual cycle, and that builds back into the profiling questionnaire. So that works on an annual basis. In terms of what happens for CAS underneath that, and we're still in discussions with Living Well around how this will be funded and rolled out, and Ian's going to talk about this at the end of the presentation, I hope, the idea is that we've got a universal approach that all schools can access the profiling tool and the planning tool, and when it's ready, the individually tailored CPD. But to ensure we can build a targeted offer to support those schools who have a greatest need for support, we're developing what we call localities. So the locality within Bradford, there will be a few different localities, but will be Living Well. So it's been run by CAER, the University of Bradford, Living Well coming together, as well as the wider CAER partners. And they will be seeking to support creating active schools with what we're calling CAS champions. So that's an outside of school facilitative role, where they will support schools to complete the profiling tool, bring together communities of practice for shared learning. They'll run school support webinars on a half-termly basis to support schools to implement CAS. But then the national team, because this project is not just being done in Bradford, at this moment in time, it's rolling out across the National Active Partnership Network. And we think we'll have 20 active partnerships out of 43 that cover the whole of England, and also some work within the different opportunity areas across the UK as well. So it will become part of a much larger national community of practice for the CAS champions. So what does CAS look like for you on the ground? So the first thing is the onboarding and the profiling tool. So the idea is all schools will be able to access the profiling tool, and that alongside that, those schools that may require more in-depth hands-on support, workshops will be run for those schools to come and work with us for about 3 hours to go through the profiling tool, to understand what it is, how it works, so you can then take that insight back and put it into your profiling tool. What the online profiling tool looks like. So this is an example of the policy area. There's five sub areas within this. Each have got 5 questions in this particular area. The 5 questions are completed. They look like this on the right hand side. So again, Ian's done a lot of work here with schools within the jump area. This started as an Excel spreadsheet, and is now, into a nice sort of flashy online web platform. And we've really refined down the questions and the way those questions are responded to make it as time efficient as we possibly can for schools. So once that's been completed, we then get the reporting and recommendations, and it gives schools a subjective score. So it tells you how you're doing overall, but also within each of the 4 different areas of the CAS framework. This score is not, we don't see this being shared with other people. It's not a score to share to celebrate or bash you over the head if your score is low. Quite the opposite. It's purely for yourself to understand, by the actions that you're going to take, will you improve your score in the next year, so that we see this step-by-step change year on year. But it will give an insight into what the top 10 schools are within the locality. That will then drive on the right-hand side the recommended actions, and then off the back of that will be the implementation plan, which isn't on this slide, but basically is the one on the right-hand side. So there will be while we will not have the online support available for next year, there will be webinars being run by the central team that will support similar themes to what would have been covered in the online CPD. And based on what we managed to agree with Living Well and the funding support, there will be the CAS champion support at varying degrees across areas of the city, which Ian will talk to in a second. I won't cover monitoring and evaluation now, just other than to say we're building that system. It won't be in place for next year, but we will be talking to Sport England to embed the Active Live survey to help that annual process. So over to you, Ian, if you're happy to handle the next slide and cover anything I might have missed as well.
Yeah, thanks, Andy. So just a very quick update, and you obviously had an amazing impact yesterday in the APPG meeting, because the PE and School Sports Premium was announced today that they are renewing it. 21, 22. The thing I would say is, and I don't know if any schools have seen this, it refers to children will benefit from better quality PE and physical education and physical activity next year. My challenge to that is, if it's the same funding and the same system, how will we get better quality? And that's what Creating Active Schools is all about. It's changing the system. So obviously you will have that funding as well for next year, which is good news from today. In terms of how we see Creating Active Schools working across Bradford, obviously you can see from the far right of this probably quite complicated table that we've got our jump schools. Now we have our test and learn or pioneer schools that we've been working with over the last 18 months. But we'll be starting with a new tranche of schools this September, which is an exciting way of scaling up that project in North Bradford. And they will get a range of support, not just the profiling tool, but obviously linked to the research element of the project and wider community organisations. But in terms of how CAS is used, what we want to see over time is that spread all right across Bradford. So some of you on the call will be in the CP5, Community Partnership 5 district, and that's where 5 schools, we've been approached by that partnership to use Creating Active Schools and elements of Jump to support 5 of those schools with an enhanced version of Creating Active Schools. Bradford Birth to 19, we'd started the PE and school sports and physical activity evaluation project this year. They will get access to they trialled some of the spreadsheet and initial support work with us, and those schools will now get access to the CAS training, which will be running termly, obviously the half-termly webinars, and also the use of the profile toolkit as one of our test schools. And then we've also got the Living Well RIC, Reducing Inequalities in the City project, which is 30 schools. What we're doing with those schools is looking at, they will have Living Well Schools facilitators in place, and they'll be attending our Creating Active Schools champion training, so that again we are building a consistent model for all Bradford schools over time. So they will then, those facilitators will effectively become the champions for their schools. The orange bits are basically the bits that we're still in, I don't want to say negotiation, but we're basically still looking just to confirm how we're going to fund these elements. But our hope is that we can roll out for all Bradford schools use of the profiling toolkit, access to the half-termly webinars that would be the online CPD to support that, and also the CAS training that will be run termly, which also gives us the chance to do networking. Because the best way I can sum all of this up is, I keep referring to the 3 C's, which is we want to get within Bradford around how we really improve physical activity outcomes for children. We want consistency. We need to improve capacity, because we know that schools are dealing with so many different agendas, and we see this as a way of helping us build that capacity. But that'll come through collaboration, and what we need to do is really make sure we're learning from fantastic best practice across the city. And there isn't one right answer here. There isn't buy this scheme or buy into this and you'll get the right answer for your school. It's very much, the framework is about working through a system so that we find the right answer for your children and your school. So I think we'll leave it there. The other thing I'd mention is we've also got an exciting project literally just about to be signed off from Sport England on developing Creating Active Schools for secondary schools through the secondary PE programme, which will be working with the Beckford, Star, Dixon's, and also special schools as well. So there's a lot being developed here, and what we want to try and do is pull it together within Creating Active Schools, so we definitely see the impact across Bradford.
Thanks, Ian. And I think that just to feed on from what Ian said, it's, you know, what Bradford has needed for quite a long time is a collective active schools force in a sense that helps to pull all the schools together, coordinate the work, and support each individual school to allow its autonomous implementation of physical activity. You know, we're not here, we're not coming in to say this is exactly what you should do in your school. We're helping you to build as an individual school and to understand what to invest in and make sure we can drag that evidence base into that to help inform decision making. So That's it from us. I guess over to yourself, Christian.
Yeah, thanks, Andy, for that, Andy and Ian. Will be a really important part of the city's response to, I suppose, to physical well-being and health next year. Will be the offer of the Creating Active Schools framework. A reminder that everybody will get those slides sent out to you, but everyone has a place within that offer. And just get in touch with Andy and Ian if you want any more information, but we will get the slides automatically. I'm going to hand on directly now to Duncan, who is next to me, and I should be able to do the snazzy thing with pivoting the camera in a almost semi-professional manner to Duncan to be able to talk about public health messages and COVID things. I've got busy again. Over to you, Duncan.
Okay, thanks. As he was pivoting across there, I was just there with my mouth gawping at the ceiling, wasn't I? Just so not looking particularly intelligent. And I worked out the other day, I think this is the 11th webinar that I've spoken to you all, so you must all be getting really sick of me. But I think this is the last one that we're going to do this term. And I suppose the other thing is, I know I wrote to you all last week with a public health message saying it's a slightly heavy heart, because as soon as you think getting out of things and things are getting a little bit easier, along comes the Delta variant, formerly the Indian variant, which just complicates things again. So what I'll do today is really quickly just update you on what the overall situation is in Bradford with the variant and so on. And we've got some surge testing that's going to be starting next week that's relevant to secondary schools. So I just want to make sure that heads from secondary schools are aware of that we've got on the call as well. And then there's a couple of questions as well that have come through in the chat. So I'll try and answer those. So, okay, so just to get started. So since last week, the overall infection rate for Bradford district, unfortunately, has continued to rise. It's up to 130 per 100,000 now. 2 weeks ago, it was about 50. So it's really started to go up quite quickly. It's nowhere near as high as the levels that we've seen in Bolton and Blackburn, where the surge testing that they've done there really does seem to be making a difference in halting rates going up. But it is going up in Bradford. And unfortunately, because most age groups have been vaccinated now, it's really, really hitting young people. And it's the 10 to 25-year age group where we've got the highest rates. So just to give you an examples, in those age groups now, for the 15 to 19-year-olds, it's 290 per 100,000. So that's 2 to 3 times higher than the overall rate. And for 10 to 14-year-olds, it's 188 per 100,000. And we've now got nearly 50 schools again, unfortunately, where we've got 2 or more cases, so, classified as a cluster or an outbreak. And that was down in the 20s a couple of weeks ago. The slightly good news is that we haven't got any evidence of yet, anyway, that the Delta variant is more dangerous to children. All the evidence that's coming out is that for unhealthy or unvaccinated adults, the risk of hospitalisation with the Delta variant is 2 to 3 times higher than previous variants. So that's why we're so keen on reducing the rates, because there's still a lot of vulnerable people and a lot of unvaccinated people in the district. But the average age of people that are going into hospital is going down as well. The Delta variant is really picking off those younger and healthy people. So the work that we're doing in schools in slowing down transmission and slowing transmission going back into communities is really, really important. And we're at this critical stage at the moment where we've had this 4-week extension of the last of the regulations while we go through the rest of the vaccination programme. And then by the end of term, certainly within 2 or 3 weeks, we'll be in a position in the UK where every adult has been offered a vaccine. And that is the time where really we just have to start saying, OK, we've done what we can for now, and we have to really start getting back to normal. But unfortunately, in terms of your job and my job, that does mean the pressure's still on us a little bit more for the remainder of the term. In terms of the hospitalisation rates and death rates from COVID in Bradford, the Indian variant or the Delta variant hasn't had an impact on that yet, so that's good news. but it only started going up a couple of weeks ago. And we now know that 90% of all the COVID cases in Bradford now are due to this new more infectious variant, which seems to be about 60% more infectious. So that's the update. And then there's a couple of questions that were relevant to that. So the first one was about the rationale for a staff who is a contact of a positive case taking 10 days off for isolation, even though that they've had negative lateral flow tests at school. This is a really good question, and I suppose it's whether the lateral flow tests override that guidance around being in close contact. Unfortunately, that is still the national guidance. PHE haven't changed that, and having a negative LFT test doesn't override the fact that you're a close contact of a positive case. And there's a number of reasons for that. A, the incubation period can be up to 7 to 10 days. So an asymptomatic person could be harbouring an infection even though the LFT is testing negative. And also that the LFT test unfortunately miss at least a quarter of positive cases. So there's quite a high false negative rate, unfortunately. So sorry about that, but if you get close contacts, I just think don't over-exclude teachers. Really think whether they meet those rules for close contacts before you exclude them. If they are close contacts, unfortunately, they do still need to be excluded during this term. And then the other question that we had was around transition days, and should transition days for kids transitioning between primary and secondary schools still go ahead? My short answer to that would be yes, because if one of the things that we've learned during COVID is the anxiety and mental health amongst young people, a lot of young people has really not been good. And we know that transitioning is a particularly stressful period. And I think those sorts of transition events are really, really important. So I would go ahead with those. Somebody said in the chat that the DfE guidance was a bit vague. I'll put my hand on my heart, I haven't read the DfE guidance on this, so I'm just going off what I would think. What my advice would be to do it is in small groups as possible that you can do. Remind parents about the need to take an LFT test and get their kids to do an LFT test and not bring them in if they're positive beforehand. That's another precaution you could do. And then also obviously use face coverings as well, particularly in those crowded areas and corridors and so on, if you can't guarantee social distancing. I think if you implement those and all the system of controls that you've been using in classrooms for months now, I don't see why transition days shouldn't go ahead. I think the potential harm of stopping those it outweighs the benefits of the importance of those for kids. So I'd go ahead with those. So that's the two questions that I got. I'll have a quick look in the chat afterwards to see if there's any more. And then the final bit, just to update you on, is because of the Indian variant, the fact that Bradford is one of those areas of stubborn transmission, when things start to go up again, it always kicks off in Bradford. We all know that. We've got some additional funding, testing, go ahead to do surge testing in Bradford district. So there's 11 wards in Bradford at the moment that we're encouraging all people in those areas to get a PCR test and to use the drop-in centres and so on. Because we've got such high rates in school, in those 11 wards, and I'll read out the list of schools in a sec, what we want to do is offer additional PCR testing starting from next week. So the rationale about this is the increased infectiousness of the variant, that we've still got a lot of adults that are unvaccinated, but we'll send you all this information, and the increase in school outbreaks that we're increasingly seeing in particular those areas. Now, what we're really keen on is making sure that this doesn't disrupt the school day, and there's got to be a balance between that and getting the additional testing. So what we've done is we've employed the COVID testing, and we'll send the details out to be able to deliver a big batch of PCR tests to the secondary schools, 19 secondary schools in those areas, and then we'll be asking you to hand those PCR kits out to children to take home. They've got all the instructions in them about how you register them and so on. So it's a switch from LFT to a more accurate PCR test just for the next couple of weeks. And then the hub will come back the following day, and the kits that have been returned will be put back in the boxes, taken away to the laboratory, and then any of those positive tests will go into an enhanced testing scheme. So that's the plan. Covering 19,000 children in 19 schools is obviously a big undertaking, and that's why we wanted to ask for your support on this, to just work with the hubs around this and pass the testing back to parents at home, rather than you having to set up big testing centres for a couple of weeks in schools, because I know that was hugely disruptive before. So we're going to send out information tomorrow, and the schools that we're going to be asking, and I'll just read out the list now quickly, are Bradford Academy, Bradford Forster Academy, Bronte Girls School, Carlton Bolling, Dixon's Macmillan Academy, Dixon's Trinity, Dixon's Allerton Academy, Co-op Academy Grange, Dixon's Kings, Beckford Upper Heaton, Bellevue Girls, St Bede's and St Joseph's Catholic College, Dixon City, Dixon's Free Sixth Form, Oasis Academy, 1 in a Million, Buttershaw Business and Enterprise College, Beckford Thornton and Bradford Girls Grammar School. So what we'll send out to those schools tomorrow that are on the call is a sample letter for parents explaining consent and what to do, a letter which basically outlines what you need to do as a school, and then any other sort of information sheets as well about financial support and things like that. So there's a lot of caveats to this work. We realise that uptake might be quite low because a lot of kids aren't taking LFTs now. We realise that those schools, catchment areas, some of them really go across the whole district. And we realise that some children, particularly vulnerable children, are still doing tests at school because you've kept on testing facilities. We've got no easy way of doing this, but we thought bringing the kits to school, you handing them out to the kids, putting them back in the boxes the next day and giving them back to the COVID teams would be the simplest way of doing it to minimise disruption. So that's what we're going to do, and I can take any questions in a second. You'll have noticed there's a lot of the Dixon's academies within the central city. There's 6 or 7. We've had an initial chat with Nick Weller, who's the chief executive of Dixon's, and he's on the phone anyway agreed to this in principle because it's going to be time limited and we're trying to minimise disruption. But I'm hoping Nick is going to send through some just a little bit of information through to you as well, just saying that he's spoken to the council about this. So I think that's probably the main things. What we'll do as well is supply an email address and phone number so that you've got the dates and you've got somebody at the end of the phone to say when they're going to be dropped off. And the idea is to drop them off in the morning and then pick them up at the end of the following day. So that's the surge testing. And what we'll do is we'll review it after 2 weeks to see whether the PCRs have been returned and so on, and what the uptake rate is. And if it turns out to be a colossal waste of time and money, we will stop it. I don't want to keep anything going that isn't cost effective. But I think what we need to do, unfortunately, is we've got to try everything we can and all these different interventions to try and, for at least the next 4 to 5 weeks, try and suppress the Indian variant, the rise of the Indian variant. Sounds like a new Avengers film. In schools. So we've got to try and repress that. So that's it really. But all just to say as well, because of the increased infectiousness, all the key COVID controls that you're using already, they're the main things that we've got. Testing, social distancing, space, reporting cases, just keep doing that and really, really appreciate everything you're doing. Okay.
Okay. There we are, as if we are. Thank you so much, Duncan. There's quite a lot of comments that are coming back in from the chat there. We're not sick of you, and thank you very much for continuing to talk to us through the year. I mean, it's been really noticeable for me how, how mature the system has become this year, how much we've learned together as a community of schools, how much we've learned together as a joined-up system. This is what the whole of the CAER network is meant to be about, what the Living Well offer will be about. It's about people talking to each other, systems working together, organisations working together. We have worked incredibly hard this year, worked incredibly hard, all of us, to make the best of what's been a very, very challenging year. And I think I would want to, on behalf of everybody here today, ask Duncan to pass his thanks back to the public health colleagues within Bradford Council who've worked so tremendously hard, as we all have under difficult circumstances. I've got the opportunity now to pass on to friend and colleague Peter Day, who's going to have an input today to everybody on the call on oral health, and I'll pass on to Peter now for 5 to 10 minutes.
Thanks, Christian. Thank you very much for your time. I hope you can all hear me. I'm just looking at my slide deck. Yep, great. Okay. I realise this is slightly into the mainstream, but it was just very much to give you a quick update on what's happening around dentistry and oral health. And I've just got a few slides to run. And I realise that there are some quite big challenges around oral health and dentistry in the district. And it's just to update you briefly on where we are and what we're doing and the impact of COVID. So if I can start my screen sharing, I will try my best. Can I check that's working?
It is.
Great. Okay, so my name is Peter Day. I'm a children's dentist, which is great. It means that I work with children up to the age of 16 and persuade them that they want to come and see me. And I work both in Leeds and Bradford. And in addition, I'm also an academic in Leeds and our research works across both Leeds and Bradford. Just to set the context, we know that by the age of 5, at least a third, if not 2/5 of children by the age of 5 have decayed and rotten teeth. This is just an example of a daily challenge that we come across. And so very much by the age of 5 in most of your schools, approximately 2 out of every 5 children will have decay in their teeth. And for those that do, unfortunately, they have 3 or 4 decayed teeth. Obviously, some will have a lot worse and some will have a lot better. And I'm sorry for disturbing your afternoon cup of tea with gruesome dental pictures. As children get older, their decay rates get worse in the primary dentition, and obviously the primary dentition is then shed by the ages of about 10 and 11. And then, unfortunately, the permanent teeth start to get affected. And by the ages of 12 to 15, between 30 to 50% of adult teeth or children with adult teeth have decay as well. The impact of decay is not just for children, but it also has an impact on sleepless nights, pain, attendance at school, attainment in school, but also impact on the parents with regards to time off work in order to take them to the dentist and to care for their children. To put it in context, dental treatment under general anaesthetic is the most common reason why young children have general anaesthetic. It's 3 times more common than any other operation for our children aged 5 to 9. And it obviously has a significant cost both to the child, their family, and also to the NHS. But on average, when children have a general anaesthetic, they take a minimum of 2 days off school afterwards, and many take a week at least before they return to school. Looking at the impact of COVID, we know that lockdown has had a significant detrimental effect on some of those home behaviours, with a reduction in toothbrushing behaviours and an increase in sugary foods and drinks. So I'm sure there will be more decay coming our way as those behaviours work their way through, but it may well take another year or so before we see them at their extreme. From a dentistry point of view, Bradford has always had a number of challenges around access to dentistry. Where we are at the moment is dentistry was closed for the first couple of months during the first pandemic and now is reopening. However, because of a number of the precautions, we're only back to about 60% activity. And that probably impacts more on those who are looking for routine checkups than it does. We are confident that those children who are in pain and having problems will be able to access dental care through NHS 111 and the emergency dental service. The problems have also led, due to lack of operating time, to increase in waiting lists for children needing dental care under general anaesthetic, and a number of other waiting lists have increased as well. With regards to school-based activity, the fluoride varnish programme, which is happening mainly in nurseries and primary reception classes, has restarted recently, as has toothbrushing clubs and toothbrushing activities in schools. And so I can happily provide advice on how we can run those programs. Obviously, the fluoride varnish is an external, which comes into the school and applies the fluoride varnish. The toothbrushing clubs, I can happily provide you and point you to the direction of my colleagues in Bradford District Care Trust, who can explain and support to make sure that you're delivering those clubs in a COVID secure way. Over the last year, there have been some changes to guidance, and the early years framework has changed, and now oral health is mandatory as part of that work. And we're working on how we can support early years and nursery foundation to comply with that guidance. In addition, it has also moved into the PHSE curriculum, both at primary and secondary schools. And there are some examples of materials and lessons that can help and support in that space. In addition, through colleagues at Bradford District Care Trust, there is some capacity to provide some assemblies or other activities if you felt that would be helpful within your school setting. And there is also some short videos and resources which can help to cover some of the key behaviours and activities around that space. And then just a couple of thank yous and some headlines of work moving forwards. I know and I recognise that some of you, the schools that are online, have supported the Bradford Smile study. I really thank everybody who's been involved. We recruited over 350 children working with primary schools in Bradford, and that is now showing some strong results moving forwards, which we're soon to release. And then secondly, we have a project working with 3 Bradford-based secondary schools, which is called the Bradford Bright Study. I was out this morning recruiting and examining children in Leeds for some of the schools over there. But we're doing our final data collection for that study in the next term within the 3 schools, well, within the final 2 schools, because we've already caught one of the Bradford schools earlier this month. And then finally, research-wise, we have some further research funding looking at 3 particular project areas. And if anybody would be like to get involved or is interested in this space, we have some NIHR, so National Institute of Research funding, to look at how we support children with autism and encouraging oral health behaviours in that space, of which some of those behaviours and activities may well happen in all settings. And we realise how important both mainstream and special schools are to support those activities. Secondly, for our nursery colleagues, we have some resources that we are trialling around the educational piece and supporting nursery teams to deliver oral health activities in nursery settings and ensure they're compliant with the latest guidance. And then finally, with regards to toothbrushing clubs, we have a national research grant looking at the uptake of toothbrushing clubs in schools, in obviously nursery and primary age children, and looking at the barriers and facilitators to that. And if anybody's interested, they were only too happy. Finally, my email address is at the bottom here. I've somehow managed to put an extra E in, but it is leeds.ac.uk. And I'm only too happy to answer anybody's questions afterwards or now in the chat. So, Christian, thank you.
Thanks a lot there, and I've also put Peter's email details into the chat as well. It's really, notwithstanding the challenges that we keep talking about, it's good to see progress and some encouraging signs about the offers that are now going to be made available to school and in a way that you can access. Okay, so just a few moments from me about Living Well schools, and I'm going to ask Katie remotely to be able to share the 3 slides I've got. Can you just go over the first one, please, Katie? Oops, Daisy. There we are. Okay, so this is a once again, I'm on a standard message here. It will take me almost no time. Just to be really clear that counselling and support offer is still open for school staff. I know it's about pupils' physical health today, but we can support physical health if we're in a mentally sound position ourselves. It's been a difficult year. The information I'm getting through from the providers of counselling support is that there was a bulge of referrals, a bulge of people getting in contact with them. Immediately the offer came on stream. And then since schools have been coming back in, then we've seen another surge of interest, and a kind of like a need being presented by school colleagues. And it may be as we move towards the summer holidays, when we've got the chance to stop, when we've got the chance to not think about school, not be taken up with the kind of like the fight and flight, the demand upon us where we have no way to get away from that. When we're in a quieter place, sometimes that's when our mental health can be most challenged, when we've had the chance to stop and think and it all comes home. So those numbers are still there. We've got some places available. And importantly, we'll be able to offer up some more of those places into the new academic year. Really clearly, as well, just to point you in the direction of the Seller Trust offers there. Colleagues might not want to go through the individual attention that comes through counselling and therapeutic support, but they might just want to join on a very straightforward drop-in course that the Seller Trust run, and they're available there as well. Just move forward, please, Katie. Okay, so this is about the Living Well schools. I'm calling this afternoon webinar the last one that we'll be having this academic year, but also in a really positive note, pivoting towards next year, where I'm boldly saying that we will be properly dealing with COVID recovery, not COVID response, and we're probably, I am hoping, in the last days of that response in terms of the school system, which is this term. Into next year, we must join together as a city in a joined up systems approach, all schools, working for all children, working with the council, with the academy system, with schools, with the health, with the CAER Trust, the CCG institutions that we have in the city, in a joined up offer there, which is Living Well schools. One single place to go to pick up all the information that you need, one single place to be able to access the resources and the substantial support that is there and needs to be accessed, because our children and young people in the city need that support in the space of physical health, social, emotional and mental health, and classroom inequalities. There is a really powerful offer coming together next year. It is a marathon and not a sprint that we're engaged in dealing with the challenges of COVID recovery. And I'm letting people know that in September next year, early on in next term, we'll be launching the Living Well Schools offer and combining that with an offer out through the webinar. And, God willing, fingers crossed, we'll be able to have some in-person meetings as well next academic year. So Living Well schools, get used to that term. It's going to be a pivotal force for good in Bradford over the next year and into the medium term as well. Living Well schools, a website, CPD offer, support offer that will be carried out to all children in the city over the next academic year. So into September will be our next webinar offer. Okay, next slide, please, Katie. To underpin those conversations, we've got the Bradford School Leaders Forum, which is being built and it will be ready to be released into the next academic year, which is a way where we can communicate with each other across phases, across localities, with a discussion forum with groups, threads and messages, direct messages and document storage available within that. We will be reaching out to all Bradford school leaders to provide them unique and individualised access to that school leader forum, so that we don't have to be using a collection of WhatsApp groups, direct messaging, texting, that we can all go to the same place to be able to find the information that we need. A really powerful offer into next year as well, the Bradford School Leaders Forum. So if you're part of a multi-academy trust group and you'd like to have a space within this, if you're part of a primary locality group, or you're the Bradford Primary Improvement Partnership, or you're the Special School Network, or Keithley Schools working together, or whoever it might be, you've got a space and a unique kind of grouping that you can establish within the Bradford School Leaders Forum. That's been paid for, free service, paid for by out of Bradford Opportunity Area funding. Okay, Katie, you can finish the slides. Finishing today's, we're going to be handing on to our head teachers. I am grateful for the support that they have given this offer this year. That offer will also carry into next year. We're working with Bradford head teachers, and I'm letting the room know today that there's an opportunity for some further head teachers to join with us, to join this group, to act as a focal point, but also as emissaries, as communicators for the Living Well offer and for the COVID recovery offer. So there are some spaces for people to join in that offer and to join that team. We've got Sarah and Lynette and Rob talking today, and we've had other head teachers talking through the year. If you're interested in joining that team there, small amount of funding available, but please get in contact with me directly. I'm going to hand on to just a slight juggling of those head teachers today onto Lynette first, because she's got to go to a trust board meeting. I'm going to hand over to Lynette now, one of our head teachers, and over to you.
Thank you, Christian, and evening everybody on this nice warm muggy evening that we're experiencing. So my little bit tonight is really building on what Andy was talking about earlier and Ian. We've been at both Grove and Crossley. They have been at a jump school, which has been fantastic, and we've really appreciated those extra pennies and been able to do lots with it. But I think what I'm hearing and what I'm really understanding is that this idea around active learning, we really need to think of the pedagogy around that, because it really isn't just about PE experiences, thinking about other areas of the curriculum in partnership with our PE and sports etc. provision, and how we can in general get our children to be more active and moving around and getting them being a little bit more physical. So you know, we've really looked at both of our schools, at what space we have available. And despite the fact that Crossley is on Thornton Road, which is very, very busy, every time we hear a siren go past, we call it the Crossley Hall anthem, because it is so busy. But we've really gone back and looked at what land and space we have. So we're lucky here, we have a lovely allotment space. We have some field space as well. And a few years ago, gosh, more than a few years ago now, we were lucky enough to have some lottery funding to create outdoor storytelling areas. And we even have an Anderson shelter on site as well that was built, which is doubly interesting because we've had to put a gate on it because somebody moved in. Apparently some staff thought that I'd been very realistic in putting somebody in there. Turns out it was a real person. So there's lots of spaces and things for people to use that we've had to really go back to, because like anything over time, the approach changes. Things that we once use a lot are then used less, and we're just thinking about going right back to basics there. We're also looking at, again at both schools, our provision around forest schools. We used to deliver forest schools across the hall, and we haven't used it as much. We've never used it at Grove House, and we're looking at how we can use that and get children outside, get children being more active and more physical. We're very aware, and I've spoken about it a lot anyway, but how being active has that impact on your mental health and well-being. And definitely for me, even though I would absolutely hate running and struggle to put my trainers on at the moment, I know when I come back I'm going to feel great. But just getting out, going for a walk, doing those kind of things makes us feel better. Another thing that we've done, we've invested in bikes and scooters so that we can use those with groups. We've even had some scooter stunt style workshops, and some of our teachers have been involved in those, so can even do their own stunts on the scooters now and show those to children. But again, how can we build that into other lessons rather than it just being about PE, playtime, lunchtime, etc. We've worked closely with Sports UK at both schools as well, and the director there, Will Smith, is fabulous with his ideas and things, but again around how we can build active learning into curriculum rather than it just being about sport and PE provision. I think it's great that what Andy was talking about and us having a framework to follow and using that as a school for improvement, and how we can move things forward. We've clearly got the experts in the city that can support us with that, and there's that real evidence-based approach coming through, which we know is very, very powerful. But for us at the moment, for our curriculum, we have gone right back to basics. We've also, at Grove in particular, from September, a member of SLT is going to be in charge of leading active learning, and that's going to be all elements of active learning through the curriculum. And that, I think that's going to be a really powerful driver for us. Definitely engagement and conduct in lessons is better if children are doing and moving, and we can train them how to do that well, but that's something that we're keen to push again. So like I say, real back to basics for us, looking at what we've got. Budgets are tight. We've sat through budget meetings today. They're incredibly tight. So, you know, we're tight on that spend that we've got, but what have we already got and what can we do? How can we get children moving again? I don't think I've said anything that anybody doesn't know or isn't aware of. But you know, if anybody wants to chat or email me, always welcome. Also come and look at provisions and things we've done with our jump money. We can absolutely do a COVID safe visit. And I think that's all I've got for you this evening, Christian.
That's great. Thank you, Lynette. Thank you to you for your support this year. I'm going to hand over to whoever from Rob and Sarah who are talking to a similar subject. Whoever wants to go first. Sarah's looking particularly keen, so I think
I'll tell you why I'm keen, because I'm always last and often missed off. Where is Mark Mon Williams? He often misses me off, and I'm just a poor cousin to the beautiful Rob Whitehead.
Sarah, please go first, but you need to sing, okay?
Well, I'm not going to sing. I'm going to start by telling a wonderful joke, which is Christian contacted me and said, "Oh, Sarah, will you please do some talk on diet?" I said, "It's not my area of expertise. I'm 6 stone overweight." So let's move on from there. I'm looking at Mr. Valentine because I need a bit of personal training with you, I think, Dick, on the back of your bag. Anyway, what I'm going to talk about is what we've done here at Newby in terms of our physical activity. We all know the benefits. I don't really need to talk to you about the benefits, but one of the key ones we felt was, one, about getting out fresh air and running around and getting fit, but also the mental health benefits. So here at Newby, since September, we made the decision to increase our playtimes to 30 minutes in the morning and 30 minutes at lunchtime. So we nearly doubled the time for children outside. And we thought, and we are hoping we're going to continue that beyond COVID because of the positivity that has given our children that physical time. We also invested heavily in providing sports equipment for the children to use at those particular times. So they are very much more active than they ever were. And because they're in designated spaces, they've got more room because we've done a much more timetabled area and zoning outside, which has allowed our children to have a lot more room. Essentially, it was first because of COVID and bubbles. Actually, it's had a really massive impact. So our children got much more space, and it's really allowed that team building to build. We've, as soon as possible, we've reintroduced clubs with a real focus on physical activity. That's been very important. We've got a full a full timetable to go in September. So we've got a variety of things such as yoga, taekwondo, various things such as that. But during lockdown, we introduced the Wellbeing Wednesdays. We had a real big focus of move away from screens, with a big emphasis on physical exercise, yoga, getting outside, and we've continued that. And also, since we returned to school, one afternoon a week off timetable, and we did a real big focus on the chunk of time on physical activity and exercise and the huge implications that has on mental health. That's definitely helped. We're currently taking part in the 30 Days Wild from the Wildlife Trust, which Year 3 had a picnic lunch outside this week. It's not necessarily physical activity, but it's a big push to get people outdoors, outside, enjoying the outside. We have an allotment now, which is we've got really basically at the beginning of lockdown, and we've developed, and it's going to be our forest school, so that we have a forest school very nearby. My previous school had one on site, and we believe in that as a really important learning place. We have a growing number of children cycling to school. This is another big part of what we've done. However, I'm absolutely concerned because I can't get them to wear helmets and I don't know what to do. So if anybody knows of anywhere I can get free helmets, let me know, please. Contact. There's lots and lots of children starting to come on the bikes, which is great, but not without helmets. And then we've got our 30-minute lunchtime clubs. In terms of nutrition, we are going to be one of the lead schools. I know Ian's still on, and I'm working closely with Ian Holmes and Nikki Knowles from Public Health around the building of the Living Well schools. For some reason, I think I just went to the wrong meeting and I'm too gobby as usual, which has meant that I'm helping lead that. And I am absolutely passionate that's going to have a massive impact if we all do it and we all do it well. So if you are on the line and you've had an email from me this week with regards to being one of the 30 schools, and we're having a breakfast, and I will put food on. There will be food, Richard. So I will put some on the 6th of July, 8 o'clock at Newby to launch the Living Well. So if you're on the line in your Barker End, Dixon's Manningham, Green Lane, St Oswald's, Atlas, St Joseph's Catholic, Bradford, Fernville, Wetley, St Stephen's, All Saints, Bradford, Feversham Primary Academy, Lowerfield, St Mary, St Peter's, LePage, Newby, Westminster, Dixon's Marchbank, Killingall, Byron, Rainbow, Pure Park, Burlington, St Phillips, Dixon's Music, St Williams, Princeville, Copthorne, Frising Hall and Poppers Farm. You are all invited. And that'd be lovely to see you all. I'll hand over to the gorgeous Rob White.
Thank you, Sarah. How does one follow the whirlwind? That is Sarah Rawnsley. Thank you so much. And I'm very happy to go on last. And heaven forbid that I should knock you off the roster, Sarah. So, my title was Restructuring the School Week to include physical activity and well-being. So we've been through quite a process with this one over the course of this academic year. And again, as Sarah was saying, it's COVID. Much as we never wanted it and never want it again, it's taught us some things about how, you can run the school for the better, really. And I was really interested by what Andy said much earlier on in this webinar about how, schools should really be embedding physical activity and that it should be at the heart of your school culture. And that's been the drive behind the changes that we are making as we plan for our new academic year. So as for all schools, the development and the progress of our disadvantaged pupils is really important to us. It was a big focus for us before we went into this pandemic, and it's certainly one as we come out of it. We particularly are aware of the impact that the pandemic has had on our disadvantaged pupils with regard to physical health. So as we planned for next year, we had heard about a number of schools across Bradford that had changed their school week to accommodate initially PPA in the afternoons by closing on a Friday afternoon. I was interested in this, but also knew that that particular model wasn't something that would work for our particular school community, and obviously every school across Bradford has its different needs. But for us, in talking to governors and from the work that we did in school, we knew that closing completely on a Friday afternoon wasn't going to work for us. So we worked very closely with our governors and our leaders and school staff to kind of develop a model that we thought would work for us. And so we're not exactly closing on a Friday afternoon, but what we are doing is finishing formal lessons at 1:30 on a Friday in September, and then providing a really broad, engaging and enriching selection of activities for our children. Discussing this with parents as they think about next year, we know that excuse me, all of my devices are letting me down this evening. We know that just plug myself in, hope I still work. The vast majority of our children are going to be staying on a Friday afternoon. So although some of our teachers will be going off and having their planning time, the school is going to continue to be a hive of really meaningful activity. And we've now named it, we're calling it the Saltaire Primary School University. We're really excited, but the really big drive behind it is around promoting both physical activity and mental well-being. So some of our enrichment activities will be the traditional art and music and technology, but we'll also have a broad range of physical options as well. So that goes from yoga and Tai Chi, a range of traditional sports, so the whole range of kind of national curriculum sports that you might have as well, forest schools, dance, gardening, which obviously is a very physical activity as well, and so a broad range of clubs that children can have a genuine choice around. So we anticipate that each group will have around 20 children in it, which means that they'll kind of have an opportunity to really engage in a really meaningful way with the activities on offer. And once the programme is well established, we're kind of planning, as we roll that out in the years ahead, to reach out to local organisations as well. So we hope to be able to work with, for example, the local cricket and tennis clubs that we have nearby. We have a nature area that we work closely with the organisers of that, and hopefully working with secondary schools as well going forward too. And we really believe there's a real buzz around school at the moment as we kind of talk about what's ahead. We're going to promote it next week in assembly and kind of get children really excited about what's to come. And we really believe that it's going to be a really beneficial offering for our school. We know that Ofsted have a view around schools closing on a Friday afternoon, and that they, particularly as we come out of this pandemic and the focus on recovery, that what's on offer is really meaningful for children, and we believe that we've designed something that does that. And so there is going to be a broad range of interesting activity and a real renewed focus on physical active lifestyles. In addition, because children will be mixing, fingers crossed, COVID allowing, it also will really develop their social and cultural opportunities, working with children of different age ranges from across school as well. So we're really excited about that. Maybe I'll have an opportunity to update you in the new year about what that looks like. And obviously, if anyone wants to talk to me about the plans that we have in place, or would like to come and see it in action at some point in the new year, you'd be really more than welcome. The proof is yet to be in the pudding, but so far, really happy with what we've got planned. So hopefully update you next year as well. Thank you. That's all from me.
That's really good. Thank you, Rob, and thank you, our head teachers here this evening. Reflecting back upon the year, I'm really absolutely in awe of the efforts that schools have made this year and the journey that they've been through. And it's been, I suppose, a privilege really to be able to work with you in the way that I've been able to, and support some of those conversations through this year. We are uniquely, I think, properly slightly ahead of time. So I'm going to give you all an early finish this afternoon, 10 minutes early. Just to be really clear, the offer of that joined up conversation, reaching through next year between different phases, different localities, which is the COVID webinar offer. We may call it something different. We may call it just a different phrase, which means that we can slowly lose sight of what of that fight against COVID and join into a fight around children's mental, physical well-being and reduction of classroom inequalities as something that doesn't mention COVID. Let's hope that that's what next year will look like, and that we'll be doing bigger and bolder work, which is positive and no longer fighting against the COVID pandemic. We live in hope. Next year, into September, we'll be running a series of events. I'm hoping for a hybrid offer of webinars and in-person meetings. Living well is a really important direction of travel for the city next year. There's lots to be done, and we can only do that as a joined-up system. The school works with health, works with social services to deal with what is a complex challenge facing the city. Thank you for your support this year so far. Thank you for your time and your energy. Look forward to further time together next year. If you're interested in a head teacher, in supporting the head teacher panel for Living Well, get in contact with me directly. Quite happily to have a one-to-one conversation about that. But for now, I'm going to close the webinar. Thank you for your attendance, and I look forward to further conversations next year. Good evening, everyone, and goodbye.
Thanks, Christian.